Chapter 13. Common emergencies in the home. Emergencies are common in every home. Children are always getting into trouble in one way or another. This is perhaps how they learn, by experimenting with all kinds of objects. Parents must therefore expect to have troubles even with the best behaved children. They must know what to do in an emergency, whether it involves children or adults. Here are a few suggestions. Burns. Burns are serious, not only because of pain in the area of the burn itself, but also because of possible chemical changes in other parts of the body. Burns are among the most common household emergencies. Young children are often burned by hot liquids, stoves, radiators, unguarded electric outlets, firecrackers, chemicals, irons, gas fires, and sunburn. The greatest danger arises from shock, which so often follows a deep burn involving a large area of the body. See page 109, How to Prevent Shock. In severe burns, the loss of body fluids can be very serious, particularly in a young child. The kidneys and adrenal glands may not function well, and other internal organs may be vitally affected. Even a relatively small burn may produce a serious deformity if it occurs over a large joint, such as the knee. Deep burns often result in the formation of considerable scar tissue. If this scar tissue interferes with the function of the joint, it should be removed by plastic surgery. Treatment: minor burns can usually be treated at home. Immediate application of ice or the coldest water you can get will often limit the extent of damage. Apparently it takes a few seconds at least for the heat to soak in, so that immediate application of cold has some neutralizing value. It also limits the amount of pain. Ice is useful from the standpoint of pain even some hours after the burn has occurred. After the cold treatment, you may gently. Burns 121. Sponge the area with soap and warm water, then apply a Vaseline dressing. Bandage this firmly in place. The pressure helps to control the pain and minimize the loss of body fluids. If the pain is severe, give the patient 1 or 2 tablets of aspirin and repeat this every 2 hours as needed. Be sure the patient is protected against tetanus. Most doctors advise everyone, young and old, to take a series of tetanus toxoid injections, as outlined on page 188. Severe burns involve the deeper layers of the skin and usually cause large blisters. If necessary, cleanse the skin first, removing all contamination by means of soap and water. Large blisters may be opened and drained. For this purpose, use sterile needle, or a knife blade that has been passed through a flame. Apply Vaseline gauze to the burned area and bandage firmly in place. If more than 10% of the body has been burned, the patient should be hospitalized without delay. Burns are always more serious when face, hands, feet, or genital organs are involved. If the victim is in shock, but is still conscious, give him sips of warm water. Carry him gently to hospital. Never give any liquid to an unconscious person. Chemical burns are often serious, and may result in deep scars. Strip off all contaminated clothing immediately, and wash the area thoroughly with plenty of water. If possible, allow the water to run over the burn area for several minutes. If the chemical is a powerful acid, try to neutralize it with moist packs soaked in a weak solution of baking soda. Burns due to alkali may be neutralized with vinegar or juice from a lime. Carbolic acid burns can be neutralized with rubbing alcohol. For severe burns, apply wet packs as suggested above, and take the patient to the doctor. Steam and dry heat burns should be treated as any other severe burn. If the patient is feeling weak, give him a warm drink. If he is unconscious, keep him lying down, but do not attempt to give him any liquid. Electrical burns, treat as for severe burns, see above. Sunburn, apply olive oil or cold cream to the burned area. Keep the patient quiet, lying down if at all possible. Aspirin may be used to control the pain. Ice packs and cooling applications, such as towel dipped in ice water, can be applied to the burned skin to relieve the pain. Calamine lotion has also been found helpful. If the patient has been severely burned, he should be taken to hospital. 122 common emergencies in home. Choking and strangling. Young children will swallow almost anything small enough for them to get into their mouths. Small toys, seeds, pieces of wood, pins, nails, coins, fruit seeds, any of these may cause trouble. Sometimes the object becomes lodged in the throat, at other times in the windpipe, or perhaps the esophagus. Parents should protect their young children from the danger of strangling, providing only toys that are perfectly safe. What to do: hold the victim forward, head down, and slap him vigorously on the upper back between the shoulder blades. Another method is to lay the child across the bed with head and shoulders hanging over the side and slap the upper back. If the victim is a young child, hold him up by the heels and slap his back. Any of these movements may help to dislodge the object. If breathing is difficult or irregular, give artificial respiration as suggested on page 117. Get him to a hospital emergency room as soon as possible. Gunshot and stab wounds. Gunshot and stab wounds are always serious, especially if a bone is broken, or some internal organ in the chest or abdomen happens to be injured. What to do: keep the patient quietly lying on his back. Give him nothing by mouth. Cover the wound with a sterile dressing, and bandage it firmly in place. Then transfer him to a hospital as quickly as possible. Always keep him in a lying down position with a pillow under his knees. If some abdominal organ is injured, and is visible or protruding through the wound, cover the area with a sterile dressing and keep it moist. Warm water is best for this purpose. Carry the patient to a hospital in a lying down position. Control bleeding as much as possible. If the wound is in the chest, cover the hole immediately with your hand and apply a suitable airtight dressing. This will prevent the pleural cavities from filling with air, which would interfere with his normal breathing. If the wound is large, place your hands on both sides of the laceration and gently push the tissues together. Get the victim to a hospital as soon as possible. If necessary, give artificial respiration, using the mouth-to-mouth technique, see page 117. Shock and sunstroke 123. Electric shock. Electric shock occurs when the body becomes a pathway for an electric current. The shock may injure the nervous system and burn the skin and deeper tissues. If powerful enough, the electric current may stop the heart, or bring about a serious type of irregular rhythm, called ventricular fibrillation. Even low-voltage household currents can be dangerous, particularly when the skin is moist. The longer the contact with the current, the greater the danger. What to do: be careful not to contact any live wire. Before attempting even minor repairs on switches or bare wires, turn off the current. Better still, turn off the main switch. If someone has contacted a live electric wire out on the road, do not touch him with your bare hands. Use a dry, dead stick, a dry rope, or clothing to remove the live wire from the victim. Be sure whatever you use is dry, otherwise you may be electrocuted in trying to save the victim. First aid: once contact with the electrical circuit has been broken, begin artificial respiration at once. Meanwhile, have someone call a physician. Continue artificial respiration as long as may be necessary, as suggested on page 116. If the heart has stopped, press sharply over the middle of the chest, pushing vigorously about 60 times a minute. This closed cardiac massage may start the heart going again. Continue until the pulse is regular and strong. Sunstroke. Sunstroke and heat stroke are similar in their effects on the body. Sunstroke results from direct heat rays of the sun. Heat stroke may arise from indoor heat plus low humidity. Lack of normal sweating, which is the body's way of releasing excess heat, may raise the individual's temperature to 1050 F or more. At first the victim may be mentally confused and complain of a bad headache. Later he may become delirious. Unless he is given help at once, his blood pressure may fall to a low level, and the pulse become rapid and weak. What to do: Send for a doctor at once. Meanwhile, carry the victim to a cool place as quickly as possible. Keep him lying down. Remove his outer clothing and apply ice bags or cold cloths to the head and neck, to help cool the brain and restore the temperature to normal. 124 Common emergencies in home. If possible, wrap the patient in a wet sweat and then pour cold water over him frequently until the skin resumes its normal color. Rub or massage the limbs in the direction of the heart to aid circulation. Give no stimulants. Get the victim to hospital or to a doctor as soon as possible. Unconsciousness. An unconscious person may appear to be asleep, but this sleep is different. As long as he is unconscious, he cannot be aroused. He is then said to be in a coma. No amount of shouting or shaking will awaken a patient in a coma. The trouble may be due to a stroke, or perhaps to an overdose of insulin in the case of a diabetic patient. Another cause of unconsciousness arises from alcoholic stupor or drunkenness. The treatment will depend on the cause. If you should happen to find an unconscious person lying on the ground, look around quickly for the cause. Is there an injury on the head? Does the pupil of one eye appear wider than the other? If so, the victim may have had a stroke or some other type of head injury. Are there any evidences of poisoning? Is the person drunk, or is he suffering from electric shock or asphyxia from escaping gas? What to do? Call a doctor at once. Meanwhile, keep the patient lying down. If the face is red, raise the head just little. Give no stimulants. For vomiting, turn head sideways to prevent choking. If the face is white and the pulse is weak, lower the head just a little below the level of the body. Apply gentle heat. If he must be moved, transport him in a lying position. If the face is blue, the victim is in deep shock. Unless you do something, he may soon cease breathing. Send for a doctor or ambulance at once. Meanwhile, keep him lying down and begin artificial respiration, using the mouth-to-mouth method, as suggested on page 116. Keep him warm and transport him to a hospital as soon as possible. Gently massage the limbs, drawing the blood toward the heart. Use oxygen equipment if it is available. Faintness and dizziness. Fainting is common, especially at certain times of life. It may arise from a number of different causes, such as hunger, fatigue. Fits 125. Anxiety, or even emotional shock which may occur upon hearing bad news. Any slight injury, or even the sight of blood, may bring on fainting. So can internal bleeding and severe pain. When a person faints, there is temporary lack of strength. Muscles become limp, making it difficult for the patient to stand. At first he may feel dizzy, as if the floor is moving. If he can lie down promptly, he may not lose consciousness. For a few seconds he may fail to breathe, and the pulse may be very weak. What to do? Have the victim bend forward and place the head between the knees. This may be all that is needed. If he does not improve, lay him flat on his back with his head a little lower than the body. Elevate the legs to bring the blood back toward the heart. Keep the patient lying down until he recovers. If recovery is slow, cover him with a blanket and call a doctor. His condition might be due to something more serious than you realize. Fits and seizures. Epileptic fits are among the most distressing of all human recessions. In a true epileptic seizure or fit, the victim quickly falls to the ground and loses consciousness. For a few seconds he stops breathing and may turn blue. This is followed by convulsions or strong jerking movements, involving all parts of the body. In most cases there is some frothing at the mouth. After a few more seconds the victim relaxes and begins to breathe again. Soon his color returns to normal. He may have only 1 or 2 convulsions in a whole lifetime. On the other hand, he may have several attacks in rapid succession and at fairly frequent intervals. Epilepsy is more fully discussed in Chapter 45. What to do? Try to prevent the patient from hurting himself. Loosen any tight clothing, and if possible place a small piece of wood or some cloth between his teeth to prevent him from biting his tongue. Keep him warm, but do not give any stimulants. If this is his first convulsion, send for a doctor, or take him to a hospital. Young children will often have convulsions because of an elevated temperature. Any fever, even as low as 101 degrees Fahrenheit, may bring on convulsions. The treatment is to cool the child, with whatever is at hand, ice or cool water. Rub the limbs to promote circulation, and give artificial respiration if necessary, page 117. 126 Common emergencies in home. Stroke or apoplexy. Strokes are caused by a functional failure of a blood vessel in the brain. Sometimes this is due to rupture of a blood vessel, more often to obstruction by a clot or thrombosis. Strokes are common in the later years of life. Occasionally they will occur in younger people as well. Small strokes are common, and are discussed in Chapter 45. In a severe stroke, the victim becomes unconscious and breathes very deeply. There may be Cheney-Stokes breathing, with short spells of deep respiration, followed by equally short periods when there is no breathing at all. This always means serious brain damage. One pupil may appear larger than the other, and one side of the body may become limp. The mouth may be drawn to one side. What to do? Lay the patient on his back. Raise the head and shoulders slightly and keep him quietly lying down. Do not attempt to give anything by mouth during the early stage. If there is vomiting, turn his head to one side to prevent choking. Keep him warm, and have someone stay with him until the doctor comes. Alcoholic intoxication. Alcohol in any form may cause intoxication if enough has been taken. It is responsible for many deaths, hence its use should be tabooed as a social menace. Usually it is not the drunkard but the so-called social drinker, who claims that he never gets drunk, who causes most of the trouble. The alcoholic who is dead drunk can be allowed to sleep off his stupor. This may take 1 or 2 days. Usually he is not much of a problem. But the man who is half drunk is often violent, and may need to be restrained. He may continue to drink and then go into a state of collapse. Unless he is given proper aid, he may even die. Young people should be urged to avoid the use of alcohol in any form. They should be given the truth on this important subject. For more details on alcoholism, see Chapter 46. Sudden heart failure. Sometimes an apparently healthy person will become weak and fall to the ground. After a few minutes he may cease breathing and heart failure. 127. There may be no pulse. In some cases a sharp blow over the middle of the chest may set the heart going again. Check the pulse, or better still, lay your ear down on the chest and listen for the normal beating of the heart. If there is no sound, you must begin closed cardiac massage at once. Lay the heel of your hand down on the breastbone or sternum and press sharply about 60 times each minute. At the same time have someone else give artificial respiration, preferably by the mouth-to-mouth method, as explained on page 117. Do not give up too soon. Some cases have been revived after having appeared dead for several